Good morning, everybody. It is my great pleasure to give a talk today.
Request the audiovisual team to please put up the slides. Dr. Ko? Yeah, good.
Okay. Since I have been I am very interested in visual function associated with tear film and ocular surface. So today, in my talk today, I'd like to share with you the mechanism of visual disturbance in dry eye. So shown here is the latest definition of dry eye by Deuce 2. So as stated here, dry eye is accompanied by ocular symptoms, and ocular symptoms include discomfort or visual disturbance, or both remain a central feature of the disease. Actually, there is another definition is already proposed by Asia Dry Eye Society. As stated here, visual impairment is also included in the definition of dry eye. As you know, tear film is very important for maintaining the health of the cornea and conjunctiva. Since tear film is the first reflecting surface of the cornea, it is a very important element of the optical quality for the eye. In healthy eye, smooth tear film is formed by every single blink to create a clear optical surface. But if the tear film evaporates or exposes the irregular ocular surface, it results in irregular optical surface which compromise the visual function. Visual complaints are very common among dry eye patients as you experience in your daily clinical practice. It includes fluctuating vision with the blink, glare, blurred vision, and eye fatigue. But actually, these complaints are very common in many of the patients in your eye clinic. So, unfortunately, some dry eye cases may be diagnosed as unidentified troublesome complaints without a definite dry eye diagnosis. So it is very important to note that tear film instability and ocular surface damage are key factors for core mechanism of dry eye. And vicious cycle between tear film instability and ocular surface damage get worse the dry eye condition. So today, I'd like to speculate visual disturbance in dry eye based on this core mechanism. As you know, aberrations are in eyes with corneal disorder or ocular surface disorder. Aberrations can be induced by irregularity of the refractive surfaces, such as anterior corneal surface or posterior corneal surface or tear film. So I believe you are familiar with wavefront sensor. So wavefront sensor can evaluate optical quality quantitatively. Aberration includes lower order components and high order components. Standard visual acuity measurement can measure low order components such as superior or cylinder. But however, it cannot measure higher order components. But with the use of wavefront sensor, it can measure superior and cylinder and higher order aberrations. Previously, we measured higher order aberrations in the eyes with various tear film dynamics. Shown here is a case of normal eye without any dry eye. We measure the high order aberrations every second after the blink for 10 seconds. So here is so you can see the simulated retinal image after the blink, and as you see here, optical quality is stable throughout after the blink. This is the case of normal eye. This is a case of dry eye with decreased wettability. So this condition is characterized usually with decreased wettability, meaning usually showing a decreased tear film breakup time. But usually there is no ocular surface staining and Schirmer test value is normal. In this case, you can see the tear film breakup after the, we could see the, after the 3 seconds after the blink. As you see here, right after the blink, retinal image quality is good, but you can see the deterioration of the retinal image quality after the blink. So in this case, optical quality degrades with tear film instability. It can explain fluctuating vision with the blink. This is a case of AIOC deficient dry eye. So tear volume and tear stability, both of them are decreased. And also you can see the corneal staining in the central corneal region. In this case, even right after the blink, retinal image quality is poor and it remained after the blink. So optical quality is impaired throughout after the blink in the AIOC deficient dry eye. It can explain blurred vision of the dry eye patients. Let me move on light scattering. As you know, light scattering is divided into backward light scattering and forward light scattering. Incoming light is coming from the, this is a scheme of the light scattering and light, and incoming light is coming from the left side. Actually, clinically, forward light scattering is more associated with patient's symptoms such as glare. There are two commercially available techniques which can measure forward light scattering: double path imaging and straight light meter. So previously, we measured forward light scattering in dry eye using straight light, commercially available straight light meter. So dry eye is subdivided into two groups: dry eye without SPK in the central region and a dry eye with central SPK. And what we found was both dry eye groups had significantly increased forward light scattering than normal eyes. So it means tear film instability is responsible for increase of forward light scattering in dry eye. So this is a potential effect. It shows the potential effect of increased forward light scattering in dry eye. So it can explain the glare symptoms in dry eye. As you know, shown here is a contrast sensitivity chart. Contrast sensitivity provides a measure of the ability to see low contrast patterns, which is actually closer to real-world vision. We also measured contrast sensitivity in dry eye patients, and what we found was the blue one is actually dry eye with central SPK, and pink one is the dry eye without central SPK. So what we found was dry eye with SPK in the central corneal region has significantly decreased contrast sensitivity compared with normal eyes, and dry eye without SPK in the corneal central region. It means it explains the blurred vision in dry eye patients, and actually we could say that central SPK affects contrast sensitivity in dry eye. So from the point of, so this is my last slide. So from the optical point of view, mechanism of visual disturbance in dry eye can be explained. So tear film instability actually decreases the stability of the post-blink high order aberrations, and it explains the fluctuating vision with the blink. And tear film instability increases the forward light scattering in dry eye. It explains glare. And ocular surface damage increased high order aberrations and decreased the contrast sensitivity. It explained blurred vision. So dry eye patients are always actually try to see the object under these conditions. so they feel eye fatigue. So instability of a disrupted tear film over the irregular ocular surface of dry eye is thought to be associated with decreased quality vision. Thank you for your attention.